All right, after a 3-day holiday weekend, tons of people are struggling to get up for work this morning. But if you're regularly feeling like you have no energy, or if you feel cynical about your job, or maybe you feel like you're not performing as you usually do, you could be diagnosed with burnout. Family medicine doctor Jen Caudle joins us now to talk about this. All right, Jen. So the World Health Organization has added burnout to its International Classification of Disease Handbook. That's a big deal. I'm curious how people know if they're suffering from depression or anxiety or if they're burnt out, because you would probably deal with those differently.
Right. Well, they might be dealt with differently. And you're right that it's important for us to distinguish the difference between depression and anxiety, for example, and workplace burnout. I have to say I'm actually very happy that the World Health Organization has classified this as a medical condition. I think, and so many of my colleagues know, that this is very real. But to answer your question, burnout is really defined as a condition that arises from chronic workplace stress. This is very specific to the workplace and not other parts of our lives. And there are three main components of what people will tend to feel as a result of chronic workplace stress. They may feel that their energy is depleted. They may feel exhausted. They may feel emotionally detached from their job and may actually start to feel cynical or just sort of feeling negative about their job. And then their professional efficacy, their ability to do their job and how efficacious they are, that tends to go down. So those are the hallmarks. And the distinguisher here is that this is primarily and actually completely and entirely due to workplace stress.
Okay, so I think you're sort of insinuating that you can really get burnt out from work. You're not necessarily talking about the other stressors of life. Are you making that distinction?
That's right. That's exactly right. So burnout in this particular case we're talking about here, as defined by the World Health Organization, has to do with chronic workplace stress. Now, I do want to say it's very important that we distinguish, as you mentioned before, between anxiety, depression, and burnout. And that's where sometimes we may need additional help to kind of tease through what's what, because of course symptoms may overlap.
Okay, so I would imagine that people are getting burnt out. They're probably self-medicating because they don't know what to do. So I'm curious about treatment. Do you suggest medication? Yeah. Do you suggest meditation? What type of options do people have, and how do you get time off work?
Right, right. So this is the ultimate question, right, is what do we do about this? There are a number of different options. I think the first thing is to recognize when we may be feeling burnout. And you may not entirely know, but just even the thought, gosh, I wonder if I'm starting to get burned out. That sort of awareness is very important to start out having. But other things that we can do to help with burnout is placing boundaries around our work. Maybe that means doing fewer emails at home, staying less late in the evening, maybe not working on the weekends. Other suggestions include talking to your boss or your supervisor about how you're feeling, to really work with them to put parameters around your job and to try to keep that chronic stress from really getting to you. And Elizabeth, you mentioned something really great, this idea of time off. You know, we know that a lot of times Americans do not take vacation time that they're given. Taking appointed vacation time is very important, but in this situation, we may need to take a break altogether. And I don't want to be remiss in saying there's really something important to self-care. That's meditation, as you mentioned, exercise, sleeping. But I also say talk to someone. Talk to a loved one, a friend, and even talk to your doctor or a mental health professional if you really feel like you're not getting a handle on this.
All right, Dr. Caudle, thank you so much.
Thank you.